So we've tried really hard to create very realistic CCE questions in both the Viva and the patient simulation formats. And we've tried to make it as close to the official RSCGP exam as possible in terms of the format, so that when it comes to the exam day, it feels very, very familiar. So as you can see, the record summary here, if you've done any of the CCE questions from RSCGP, it's laid out in a very similar format. Here's the case scenario. We try and include, realistic length case stems, ECGs, so that there's a very realistic feel when you're doing these questions. And then with the examiner information, the questions are listed here with prompts, also with the estimated duration, ensuring that everything totaled up adds to the 15 minutes like in the real exam. And here is the competent candidate criteria. So once you've finished the case with your partner, then you can go through and look at all of the potential things that you could have mentioned, room for improvement. There's a very clear guide here as to things that you might get awarded for saying, and ensuring that you're as prepared as possible and as comprehensive as possible when it comes to the actual exam. I'll give you another example here. It's another sample question, and this is a patient with a rash. Again, realistic length case stem with photos that you have to interpret. And then with the examiner information, realistic questions, prompts after each question, and then a clear criteria here outlining things like differentials, very clearly separating how you would actually talk through your treatment in the actual Viva, breaking it down into pharmacotherapy, oral and topical, patient education and support, red flags, escalation criteria, things like that. Now with the patient simulation cases, this is another example. As you can see here, we include a lot of information for your study partner or the role player to read up, so that they have a very good understanding of who this patient is, what they're presenting with, and we break it down into specific information: physical, psychological, social, and questions for the candidate or your study partner to ask as well. This makes the case feel as realistic as possible, and it really helps you and the role player have as much information as possible, so that when you're asking them questions, they know how to respond. Finally, with the competent candidate criteria, we try and break everything down into different sections and categories, so that after you've done the case, you can look at it and think, okay, I should have explored the menstrual pattern a little bit more, or, oh, I forgot to evaluate the patient's pain profile, or, oh, I should have done a further psychological, asked further psychological questions with regards to this patient's low mood. And so when you're looking at the rationale after you've done the case with your study partner, then instead of just listing 50 questions that you should have asked, okay, next time I'm going to structure it by firstly exploring the menstrual pattern, then I'm going to evaluate their pain profile, then I'm going to do a more formal sexual history. And so it kind of segments your history taking and provides you a little bit of guidance as to how to do history taking, rather than just saying, here's 50 questions you should have asked. It kind of has a bit of a structure and a bit of an order to help guide you through future patient simulation cases. Same thing with the differential diagnoses, giving reasonings behind each of the differentials. With the investigations, kind of splitting it between bloods, imaging, other bloods to consider but maybe not as pertinent. And then with the management plan, again, breaking it down into symptomatic relief, addressing anemia, offering hormonal options, and having different sections and categories. Again, so you don't try and just rote learn lists and lists of information, but you try and present your information in a more structured way, which at the end of the day is what the examiners really, really like to see. Here's another example of a patient simulation case, and all of the information for the role player and the competent candidate criteria as well. So have a look at a few of the cases. Like I said, we've really put a lot of thought into the structure, the length of the case stems, the questioning, to make it feel as realistic as possible to the real exam. Try a few sample cases, see how you feel, ask me if there's any questions, and hopefully you find it helpful.